Hey guys, so we're here today to work on something called internal tibial rotation. Now, this is a really hard one to get in the sense that we only have a little bit, but our knees actually should rotate side to side. So if I show you guys, we're going to rotate in and out, and it's the rotation at the tibia or the shin bone here back and forth, and I want to try to be able to gain more, which will stretch this tissue here, so we're going inwards, or internal tibial rotation. When your tibia is really tight and you can't go inwards, your hip and your ankle have to compensate for that. So by actually having a good normal amount of rotation, we actually get a good healthy knee and we stop compensating. So if you're struggling with your squat, or if you're struggling with any kind of flexion extension in the knee or getting kind of knee pain, maybe check out your internal and external tibial rotation, the ability of your tibia to rotate, because you need that to function normally, okay? So as well as normal flexion extension. So what we're going to do is we're going to set up for a Pails and a rails, which is a long stretch. We're going to hold that for 2 minutes. I'm not going to do 2 minutes in this video, but please do 2 minutes, because 2 minutes is how long it takes for your tissue to start to let go and your nervous system and everything to calm down. But the actual tissue won't lengthen if you do it for less than that. It will still absolutely feel good, but 2 minutes is what we need for that tissue to start to let go. Then we're going to be contracting the tissue that we're stretching, or the Pails progressive tissue, and then we will immediately contract the tissue that we're shortening, or the rails regressive tissue. So essentially you stretch your tissue at length, right at the end range, contract the tissue you're stretching, and then immediately contract the tissue you're shortening. This is how our nervous system keeps the range, and we start to increase that capacity. So to set this up, you best way, this is a bit of a hard one, because what you need is you need something that won't move and something that you can hook under a little bit. You can also do this against a wall if you don't have anything to hook under. I'm going to use a sofa here, but you could use a rig or whatever, but you actually need to, two things you need is you need to have something that you can hook against, as well as what you need is the knee to be somewhere around mid-range, so 90 degrees, a little bit above, a little bit below. That's fine, but it has to be in there because that's where most of the rotation comes. So if you do it at a straight leg or fully flex, we're not going to get much rotation. So if you do it at around somewhere around 90 degrees, it'll work really well. Okay, so I'm going to set this up. So we're going to put our foot underneath here. So my foot is at the edge of a foot leg here, right? And now what I'm going to do is I'm going to rotate my body. So my tibia is going to stay where it is, and I'm going to rotate my body around. So I'm rotating my femur around this way until I feel the stretch on the tissue here. And we're going to hold it. If you can keep your foot planted, that will be even better, but we just work with what we have right now. Good. Try and plant that foot and hold and look for that stretch there. If you're not feeling much stretch, you can do a little Pails where you push your foot into your immovable object, hold that for 10 seconds, and then just relax. And sometimes then you can find the stretch a little bit more, and you feel like you'll be able to go a little bit more. Good. So I'm going to be squared up here. I would hold this for 2 minutes. Now to do my Pails contraction, we need to be ramping this up to our maximal effort to increase this range. So my foot is going to try and rotate this way against this immovable object. I'm going to radiate tension through my entire body so that the whole of my body is trying to push that foot outwards. So I'm trying to plant my foot and trying to rotate out, ramping this up 20, 40, 60, 80, greatest effort. I'm going to hold that. Once you get your max, you'll only be able to hold for 4 to 8 seconds. 5, 4, 3, 2, 1, and I'm going to rail. So now I'm going to try and reverse that, go the other way. So I'm going to keep myself here, stay exactly where I am, and my foot is going to try and pull inwards. You won't feel like a lot's happening other than the tissue engaging. Same thing, ramp it up right away to your greatest effort. Hold. 5, 4, 3, 2, 1, relax. And then you'll find you can actually have a little bit of play. You get 10 or 15 degrees of range each time. So work on setting that up for tibial rotation to get the healthier knees even better. See you again soon.